More than $1 million in federal funds are headed to Black Mamas ATX. The organization is dedicated to ensuring Black women survive and thrive before, during, and after childbirth. So the dollars will come through the federal Healthy Start program, which will be used to enhance community-based operations and support prenatal and postpartum services. Joining us now is Kalene Blake, the executive director of Black Mamas ATX. Thank you so much for being here.
Thank you for having me.
So we know that Texas has one of the worst infant mortality rates in the country. For you, how do you hope to really prioritize these funds and make sure that they are allocated to really address that problem?
Our primary focus is to ensure and create collaborative efforts. This grant was written in collaboration with Healing Hands Community Doula Project and the Maternal Health Equity Collaborative. And we will continue to expand on our work as community-based organizations to enhance our services and make sure that perinatal care is available for folks who are Black and brown, who we all collectively serve in Central Texas.
Okay, and talking about the people you serve, they're facing a lot of challenges, and we've covered that extensively. What are some of the biggest challenges and barriers for the clients, the mothers that you all serve?
Truly, some of the challenges are healthcare based. Being able to get that first prenatal appointment, being able to access the type of care they need in addition to the medical care. But aside from that, there are really a lot of issues that surround the pregnancy and the perinatal period, like housing, food, and these also impact pregnancy outcomes. So it's a combination of some of these social determinants of health, as well as healthcare itself and its inaccessibility or sometimes unwelcoming environment.
Just not even having access to those basic needs.
Exactly.
Can you now just talk about the collaboration that you all have? You all collaborate with a lot of organizations across Central Texas. So you wrote this grant in collaboration with some local organizations. What is your work that you're doing with them?
So we already, as an organization, ourselves provide no-cost doula support for folks who are Black and pregnant in the Central Texas area, Austin 5-county metro. Some of the organizations in our community also do similar work for different communities. And so we've collaborated together and worked together with Healing Hands, Mama Sana, Vibrant Woman, and GALS, who are other doula organizations, as well as Partners in Parenting, who provide parent support. And together, we are just really trying to create a safety net that no one slips through when they are in search or in need of perinatal care.
And how has this work, lastly, just been life-changing for women in the community and their families?
Oh, our doulas do amazing work, and we also collaborate with mental health professionals who provide mental health care through 1 year postpartum for our clients. And so these two specific services have been life-changing for a lot of people. Doulas help people to identify complications early and get to health care as soon as possible sometimes, or they help people to advocate for themselves so they can have the birth that they are hoping for. Our mental health professionals do a ton of work in preventing postpartum depression or addressing the concerns that are creating stress and also could impact people's birth outcomes. So our team is amazing, and they really do impact lives and save lives.
Yeah. Well, thank you for all the work that you all are doing in the community. We'll have a link to your website on our website at kxan.com. Coming up, as the DEA asks to reclassify marijuana as a lower risk drug, some